Sir Thomas Roddick is a really pivotal figure in healthcare delivery in Canada. I first came to know about him because my daughter is actually a graduate of McGill University, and so the very iconic Roddick gates are very, very famous. He really was the founder of the Medical Council of Canada. He was our first president. His name is the first name that was inscribed on the Canadian Medical Register.
The founding of the Medical Council of Canada is really a long history and almost dates back to Confederation. The idea that he had was that we would have some form of recognition that was then acceptable to all of the regulatory authorities in individual provinces and subsequently territories.
When he was thinking about what needed to happen in terms of the standardization of patient care and safe patient care delivery across Canada, the recognition was that they needed someone in Parliament who would actually champion the Canada Medical Act, and he became that politician and became the person to move that forward.
He did 2 terms in Parliament, and in 1901 he became the Dean of Medicine at McGill. But he still was a major force behind the scenes and really was the driving force for the development of the Medical Council.
He was known for reinventing himself in terms of what was needed to be done at the time. He spent a lot of time dealing with infectious diseases and tuberculosis. He spent time learning with Joseph Lister, a very prominent individual in sepsis control and managing infectious diseases and wound care at that time. You can imagine when he was practicing, there were no antibiotics, so good wound care and antiseptic practices were incredibly important for saving patients' lives.
He was the Deputy Surgeon General at the time and was responsible for the medical care of troops in that region. But during that time, he also did some rather important work in terms of surgical care on the battlefield. He did introduce the first hospital train in Canada. His contribution was quite broad. You know, whether you talk about him being a surgeon and an outstanding surgeon and a role model, whether you talk about someone who's been an innovator in terms of the practice of surgery, an early adopter as far as, antisepsis is concerned, and also understanding the needs of Canadians and the patient that shouldn't be restricted by provincial boundaries.
The focus that he had on making sure that there was excellent consensus development, collaboration, consultation in very many different environments, with a focus on having a standardized approach to safe patient care delivery, really done through standardized assessment and a standardized approach to licensure. So very relevant 110 plus years ago, still incredibly relevant today.
Early pioneer in surgical antisepsis and architect of Canada's unified medical licensing system, Canadian Medical Hall of Fame Laureate, Sir Thomas George Roddick.